Hi, my name is Kiku, and I am the executive director for ReMend. We're a nonprofit organization dedicated to providing support for people on their kidney journey, whether they've just been diagnosed with chronic kidney disease or they have been on dialysis for years. We're a group of volunteers who've experienced chronic kidney disease, dialysis, and/or transplantation, and who have chosen to help encourage, empower, and hopefully inspire people going through their kidney journey. We've created Kidney Conversations with ReMen to have an open dialogue about all things kidney related. So this month, we're talking about dialysis patient financial responsibilities. We have a lovely panel for you today, a panel of experts, and I'm going to introduce them to you. Okay, guys, can you turn on your cameras and hello, hello. Today we have Cindy Polis. She's an
Good morning.
education nurse with Balboa Nephrology Medical Group. We also have Charmaine Griffith. She is a ReMend mentor, among other things. She's
Yes.
amazing. And we also have David Ordaz, who's a patient financial counselor for Balboa Nephrology Medical Group. Welcome, kids. Thank you for being here so much. I really appreciate it.
Thanks for having us.
You can hear
Thanks.
everything.
Thank
Everyone's
you, Keith.
cool.
Yep.
Okay. So, just a couple of housekeeping things here. We have a poll and a survey, or it's actually just a poll going. Let me make sure that I have that happening as I speak here. Doo-doo-doo. We want to make sure that everyone's able to answer the poll questions. It is anonymous, so feel free to do that sometime during the webinar here. And, please let us know how you're doing today. Let us know where you're watching us from. Give us a shout out in the chat box there. Just let us know who you are and how you're feeling today. So we'll be answering some questions later in the broadcast, and if you could enter your questions in the Q&A section, that would be amazing. We would love that. So, when you're diagnosed with kidney disease, I can personally say it envelops your whole thought process. You run through a whole range of emotions. Sadly, one of the major things that comes to mind is, well, how much does everything cost? Am I going to be able to pay for this? Sometimes it comes down to, am I going to be able to pay my rent and buy groceries, and will I be able to keep my job? So kidney failure treatment, hemodialysis, peritoneal dialysis, and kidney transplantation is expensive. Many people with kidney failure need help paying for that care. We're hoping to explain and provide some information to help you understand your financial responsibilities both before and after transplant. We're going to try and break down some of the financial obligations for dialysis patients and the confusing and frustrating aspects of the financial struggles. Hopefully, you'll feel knowledgeable about those challenges and be armed with resources you can use. We'll include a list of agencies that you may be able to contact to help, and we'll post that near the end of the hour. And we'll also have it on remend.org. But you got to give me a minute to add that, so it'll be later in the day today. But the most important thing for you to remember, if you're going through all of this, you're not alone on your kidney journey. You have a team of people willing to help. You can call ReMend. You can help, talk to your nurses, your social worker. So you're not alone. That's all I want to let people know. And then, there's going to be a lot of information that we cover today. Don't feel like you have to write everything down. It's just helpful to have the knowledge when you're going through it. Okay, so let's jump in. Oh, I wanted to show these amazing the information that you provided here. How much does in-center dialysis treatment cost? David, would you like to speak to this?
Yeah, so in-center treatments can cost at least $72,000 a year. Peritoneal dialysis about 53,000. With insurance, for example, through Medicare, whether it be with a Medicare Advantage plan or um, on commercial insurance like the Affordable Care Act or your group health plan that's usually offered through your insurance. Uh, In-center dialysis treatments could cost close to $10,000 a year. And out of pocket again would be for peritoneal would be about $6,000 a year. So it gets pretty expensive.
Yeah.
Yeah, but again, there is help for all this. So
Well,
um,
let me see. So, say I'm a patient that was just diagnosed with end-stage renal disease, ESRD. After the initial shock, what's the next thing after learning you have to be on dialysis and choosing your treatment method? Does the patient reach out directly to their insurance company, or does someone from the doctor's office? What's the next financial step?
So yeah, in order to find out how much it's going to cost, if you have insurance, just contact your customer service or member services department through your insurance and ask them how much is outpatient dialysis going to be. It's really that simple. If you have other type of insurance, though, for example, via Medicare, usually you'll be responsible for 20% co-insurance, which can be quite a bit. But just again, remember, you have a team of professionals that are going to be able to help out, whether it be through the dialysis clinic, a social worker, the insurance coordinators, the charge nurse, or the technicians. You also have patient financial counselors like me through your physician, nephrologist that might be able to
Mm-hmm.
help out. So
Mm-hmm.
I get these questions quite a bit. I was like, what if I don't have insurance? What if I
Yeah.
can't pay? Other things like, am I going to be able to continue to work? How am I going to get to and from dialysis?
Mm-hmm.
What if I can't pay the bills, medical bills? Because it's not dialysis. Dialysis is not the only thing that you should be thinking about when it comes to charges. It's the professional services, surgical procedures that are needed in order to prepare you for dialysis treatments
Mm-hmm.
also.
Mm-hmm. Charmaine, can you share your experience? We had kind of a similar situation, but you explained it to me earlier.
Yeah, so when I was spent some time, I was on dialysis. Goodness, it was probably like back in 2001, 2002,
Mm-hmm.
before my second transplant in 2003. And I was coming up on that what's called the coordination of benefit period, which is when Medicare has to be in place to pay as a primary, which I didn't know that about, about treatment in that. I had to figure that out on my own. But just started getting these explanation of benefits from Medicare. Like I had no idea like where they were coming from, like why do I have Medicare? I'm not 65, but there just wasn't anybody to explain that to me.
Right.
Way back in the day, there weren't, I don't know. I guess a lot of people were just, it was kind of like going through the motion of just, oh, here, sign this application or
Mm-hmm.
whatever. And I'm sure that I was told about it because, my social workers were very awesome back then, but I just don't remember ever signing an application for Medicare. And so it was just very frustrating for me because nobody could really give me any answers. So, calling Medicare to find out why, and then even talking to Medicare, they didn't really know either, so it really depends on who you get on the phone. But finally, it all worked out, but it was just very, very confusing and frustrating at the time.
Yeah, I went through the same thing, and back in the day, it's so funny, but it was almost 20 years ago, right? There wasn't the internet like it is now. So I don't even honestly, I started receiving those letters too in the mail, and I didn't know what they were for. But me, instead, I was ignorant. I just ignored it. I'm like, I don't know what this is. And I'm sure, but you've got all kinds of things going on,
Yeah.
physically, and but luckily, I had a wonderful team too. Shout out to Annette and to Kathleen Hogan. She was actually my transplant coordinator. But Cindy, do you feel that people come to you, patients come to you as well with questions about insurance and, how am I going to pay for this?
Yes, I do. There's some hurdles and it's a process, right?
Yeah.
Um, so one step at a time, and you certainly don't want this to be overwhelming for the patient. So that's the good news, as there are a lot of good resources. And so I refer to David quite a bit, and he's always been super helpful. So,
I know we're so lucky to have you here today, David.
Yeah,
Um,
mhm.
thanks.
so tell us, what benefits are dialysis patients entitled to?
So, just like every patient, you have rights and responsibilities, to be treated with respect, to have the proper amount of time that's prescribed to you for dialysis treatments and so on. But you also have responsibilities, which are incredibly important you have to make sure you go to your appointment. You have to make sure that you meet how do I put it, your goals,
Mm-hmm.
and healthcare goals and healthcare needs.
Right.
So it's you have to do your part when you're a patient, when it comes to this, especially when requesting authorization. The doctor requests authorization for services. You got to
Mm-hmm.
follow up with the doctor to make sure that it's being requested, and follow up with the health plan, make sure that they received it, make sure it gets approved and whatnot. So
Right. Um, well, let's go over this real quick. What does Medicare cover? And are you automatically approved for Medicare when you are diagnosed with end-stage renal disease?
So, first off, Medicare, I'll put it in a nutshell. So it's because it gets very complicated. Usually, when I'm speaking to a patient, the conversation can take a whole hour when explaining Medicare.
Mm-hmm.
But to put it in a nutshell, Medicare Part A, or Medicare, is divided into three different parts. Part A covers hospitalization, skilled nursing facility services, hospice care, home health care, and a few other things. Then you
Mm-hmm.
got Medicare Part B as in boy. That part covers professional services like doctor's visits, specialist visits, outpatient hospital services like surgical procedures, ambulance service, durable medical equipment like wheelchairs, oxygen tanks, and whatnot. And also, Part B covers dialysis treatments. But again, Medicare Part B is not free. Usually there is a monthly premium. This year it's $148.50
Mm.
um, a month that you'd have to pay. After that, it still doesn't cover everything because it has a deductible, and a deductible is an amount you usually have to pay up before your insurance even kicks in and starts paying for services. After that, there is a Medicare only pays for 80% of the Medicare contracted rate, which leaves you with the financial responsibility of having to pay that 20% coinsurance if Medicare is your only type of insurance.
And so, wait, what is it? So when you're diagnosed, so then does your transplant team, do they say, okay, you need to contact Medicare? This is how you do it. I mean, this is the process. Or do they reach out to people like you, financial counselors?
They usually reach out to me and I'll explain the process.
Okay.
So if you're just diagnosed with ESRD, end stage renal disease, and in need of dialysis treatments, uh, again, a lot of people don't know, but you don't have to be 65 in order to qualify for Medicare. In
Mm-hmm.
order to qualify for Medicare, you either are 65 and have worked at least 40 credits or 10 years of your life, paying into the FICA system, paying your taxes basically, for
Mm-hmm.
at least 10 years of your life. If you do that, then you might be entitled to Medicare benefits. Either that, or if you have a disability that impedes you from working for over a year, and disability is defined by the Social Security Administration. Um, and if you meet that requirement, and which, by the way, dialysis is defined as a disability by the Social Security Administration. So in order to actually get Medicare, there's different ways. If you do home dialysis, either whether it be hemodialysis, home hemo, or
Mm-hmm.
peritoneal dialysis, your Medicare coverage, when you apply, will begin on the first of the month that you begin your dialysis treatments. Like, for example, today's the 30th. So if you started dialysis treatments, peritoneal or home hemo today, your Medicare benefits would begin on the 1st of September. So I would go back to the first of the month.
Mm-hmm.
If you begin in-center dialysis treatments, then your Medicare, if you meet all the requirements for Medicare, your Medicare benefits will begin on the 1st of the 4th month after you begin your dialysis treatment. So if you started today, it would probably not kick in until the 1st of December when your treatment starts. In the meantime, when you initiate dialysis, it's important to have insurance. If you have employer-based coverage,
Mm-hmm.
it's important to keep that type of coverage if possible. And because it gives you more options in the future, especially if you're looking to obtain a renal transplant. That way you can have dual coverage, Medicare and or employer group health plan and Medicare, or Medicaid or Medi-Cal here in California. So that's usually
Okay.
how Medicare works. Oh, and there's Medicare Part D as in drugs. That's exactly what it covers. Medications. That part, it gets even more complicated. If you have more information or more questions that you have, please feel free to give me a call. Medicare Part D covers, again, your medication. But again, it's complicated. It has a monthly premium ranging anywhere between $12.50 all the way to $135 a month. Besides co-payments for medication, it also has a deductible. Usually this year, I think it's $435 a year for medication costs. So you can expect the beginning of the year to be very, very expensive if you qualify for Medicare and you have Medicare Part D as your primary coverage for medications. So that's a lot of information, and it can get more complicated. So, and
Well, what are the pros of Part C?
oh, so there's, like I said, there's A, B, and D. That alone is called traditional Medicare. Medicare with no health plan attached to it. What's great about Medicare, traditional Medicare, I'll get to that first, is that you can practically see any doctor you want as long as that doctor or medical provider contracts with Medicare. And that's 97% of all medical providers in the US. So you have this huge network of providers where you can go to, which is fantastic. The bad thing is that 20% and the deductibles that you would be responsible for if you're entitled to Medicare benefits. So that's traditional Medicare. Now, an option that many people have and is that you see a lot on TV commercials, patients who are entitled to Medicare benefits get bombarded with mail asking if they want to join a Medicare Advantage plan or Part C plan. Medicare Part C is not traditional Medicare. Medicare Part C is basically you're assigning your Medicare benefits to a health plan. The health plan is basically takes care of Part A, Part B, and Part D, all wrapped into one, which means you just need one ID card for all services. The pros about that is that, I wouldn't really call it a pro. Referrals are required for specialty care and treatment. But it also means that if the doctor says, oh, you know, you need to see a nephrologist, you need to see a dermatologist, then you see doctors that are contracted with the plan or the medical group you're assigned to in your area, which means that if you have a top name brand of healthcare like Blue Shield or Aetna or Anthem or something like that, you can't see doctors within Blue Shield. You have to see doctors in your medical group in your area, and that's only if it's approved. So there's also that referral process that serves as an obstacle in order to obtain medical services. But the pro is that, again, you don't have to be looking for your specialty care treatment. Once looked for you, one is found for you, as long as it gets approved.
Right. At least you're getting to see a physician. You're not left, you know, out there to dry. So that's a positive.
Right. Yeah. Another positive is you're usually responsible for more co-payments instead of co-insurances. Co-payment is usually a fixed amount. For example, see a doctor, you might, depending on the health plan, for a Medicare Advantage Part C plan, you'll pay anywhere between $0 to $35 to see a primary care physician. To see a specialist, $0 to $85, depending on the plan. And most services have a co-payment set, but some services are still responsible. You're still going to be responsible for 20% co-insurance. And I'm sorry, I didn't mention this earlier, but 20% co-insurance is an amount, not a fixed amount. It's an amount that you would be responsible for if you were offered any kind of services, any specialty care treatment. So it's always a lot cheaper than the co-payment is always a lot cheaper than the 20% co-insurance. Another positive thing about Medicare Part C plans are the additional benefits. Some of them will offer vision, dental, hearing aid benefit, a gym membership benefit, non-emergency transportation benefit, which is sometimes the only reason many patients choose to be on a Medicare Advantage plan, simply because when you're diagnosed with end-stage renal, you don't know how you're going to get to dialysis and back home. You don't know how you're going to feel after treatment and if you're going to be okay to come back home. So that's always a big thing. An over-the-counter allowance, basically, the health plan will give you an allowance anywhere between 50 to 85, sometimes $100 every 3 months for you to purchase items that you would normally buy without a prescription at a local pharmacy. Container of Advil, some Band-Aids, toothbrush, toothpaste, shampoo, soap, things like that.
Hey man, that helps. I mean, just even a little bit, every little bit helps, right? I mean, did you experience that, Charmaine? Like, I don't know. I don't recall anything
I
like
didn't,
this.
yeah, I didn't experience that at all.
Yeah.
I just, I do remember the whole out of pocket thing though, because that was the insurance that I had a relatively high out of pocket at that time.
Mm-hmm.
And so just by making different calls and stuff like that, I was, I have insurance. Why am I getting a bill for it? Kind of thing. So yeah, just really understanding that out of pocket or that, the annual out of pocket deductible for the year is really important.
Yeah,
Right.
yeah.
Right.
And that maximum out of pocket a year is also there as a safety net.
Mm-hmm.
You won't pay throughout the entire year a
Right.
maximum amount.
Well, let's talk about some of the cons.
All right.
Cons of Medicare Part C. Well, first, I want to say, I think it's important that we briefly spoke about this too, is if a broker is reaching out to you, don't freak out and think, oh my God, this person's helping me. I'm going to go with whatever plan that they're saying. You have options. You don't have to just jump at, this offer that this person is saying they're helping you out. Can you explain a little bit about that, David?
Yeah, so you have Medicare Advantage brokers who offer their services. You have to be really careful with them because these brokers, not all of them, so you get some really good brokers also, but some brokers will just offer you the Medicare Advantage plan that is paying them the most. They have an agenda. They're sales agents. You have to understand that. There's 73 different Medicare Advantage plans and C-SNPs, which is called chronic uh, s- chronic disease special needs programs, just like Medicare Advantage plans here in San Diego County. There's more in Orange County. There's a few less in Imperial County, and there's something like 91 or 92 in Los Angeles County. So there's a lot to choose from.
Mm-hmm.
The important thing to look out for is you want to choose a plan based on your medical needs, your medical goals, your medical cost, medication cost, and the network of providers that you're going to be using. It's incredibly important for
Mm-hmm.
that because you don't want a broker to sign you up with a health plan that's um, where you're not going to be able to continue with your primary care physician or your nephrologist.
Right.
All of a sudden, you go to a scheduled appointment, and the doctor says, "Oh, sorry, it looks like you switched your health plan. Now you got to go somewhere else." And you have to go see your new primary care physician, have them refer you to a specialist, and that can get very complicated.
Mm-hmm. Okay.
Just be
Thank you.
careful with brokers. They're again, you get a lot of good brokers that look out for your needs, but some of them don't. If you want to be screened properly, you have to make sure you contact your social worker at the dialysis clinic or somebody like me, a patient financial counselor, a patient
Mm-hmm.
advocate. You can also contact Medicare
Mm-hmm.
at 1-800-Medicare, and they'll also be more than happy to help you out finding the
Awesome.
best plan to fit your needs.
Awesome. That's great info. Thank
Yeah,
you.
sure.
So I totally interrupted you. You were going over the cons of Part C.
So when it comes to Medicare Part C, some of the cons is you have a much smaller network of, or narrower network of medical providers. Like I said, when you have traditional Medicare, you can see any doctor you want anywhere in the US, again, 97% of them. Um, when you have a Part C plan, again, you can only see doctors that are contracted with the plan within the medical group that you're assigned to. So that's definitely a con. Another con would be that same referral program. That same referral program serves as an obstacle when you want to access specialty care and treatment, even medication. So usually if a doctor, primary care physician says, oh, you need to go see a dermatologist because you have a rash on your arm, the doctor is going to go ahead and request an authorization from your health plan um, or referral, an authorization request. And that is a lengthy process at times. Sometimes it could take up to 14 business days for the health plan to respond. If it's a routine referral, if it's an urgent referral, it shouldn't last more than 72 hours. To be honest with you, routine referrals usually don't last or don't take more than a day, day and a half or so. But again, it can be quite some time. And you have, again, and I have to reiterate, you have to learn how to advocate for yourself.
Mm-hmm.
If a doctor says they're going to send a referral request to authorize specialty care or treatment, you want to follow up with that doctor, make sure he requested. You want to follow up with your health plan to make sure that they received it and what the status of that referral is. So, that's can be a pretty big con. And now instead of, again, being able to see any doctor you want, now you have to see doctors that are contracted within that plan. And another obstacle about that referral process is that I found in my experience that 70% of all denials that health plans um, give when doctors are requesting specialty care treatment, they're usually overturned. 70% of them are overturned on appeal, which is really, really important to know, because that's, again, an obstacle that you have with Medicare Part C or Medicare Advantage plans, not with traditional Medicare. Usually traditional Medicare, they don't require an authorization. If you want to see a primary care, specialist like a nephrologist, then you call your nearest nephrologist, say, hey, I have traditional Medicare. Can I schedule an appointment? That's going to be a yes, without having to wait for that referral process.
Well, how do you appeal? So what's that process?
So the appeal process is usually, once you get the denial, it'll give you some information how to appeal. You can also just contact the member services department and they say, hey, I want to file an appeal because I was denied a specialty care or treatment.
Mm-hmm.
And you go through that process, and that process can be sometimes quite lengthy, up to 30 days to get some kind of response. And my experience, again, I'm used to doing this. I do this almost on a daily. So every time a patient of ours gets denied for specialty care or treatment and I file an appeal, again, 70% of the time, it'll get approved on appeals, which means it shouldn't have been denied to begin with.
Mm-hmm.
And many times it's just because they're requiring additional information, like doctor's notes, medical necessity for certain medication or treatment, things like that. So it can be several things, something that might be just overlooked. So it's not necessarily always a health plan that's out to deny services,
Mm-hmm.
but it does happen where they just need additional information. And again, that just serves, in my experience, as an obstacle in order to obtain that care.
Mm-hmm. Oh, here, I've got another question for you. But, I wanted to also mention, because I didn't really give you the chance to say your experience, David. You are so, I can't even tell everyone how experienced David is. I mean, he knows everyone, and he's very passionate about what he does. And so could you just tell us a little bit, like, how long have you been doing this? And because I know you were telling me that hey, anybody can call me if they have an issue with this. And the last time we spoke, or you were on a webinar with us, you put your phone number and everything in the chat box. So just
Yeah.
tell us a little bit about what your day is like, how you're helping patients.
Sure. So again, I've been working for Balboa Nephrology almost for 6 years now. Before that, I worked at Rady Children's Hospital. Before that, as a patient financial counselor. Before that, I was a patient advocate at Sharp Healthcare. So I know Medicare inside out, Medi-Cal, the state's Medicaid program
Mm-hmm.
inside out, commercial insurance. That I understand it for some reason. I understand the language of healthcare, and it became really easy for me. Not just that, but you're right. I do know a lot of people a lot of social workers at every dialysis clinic in Southern California, case managers at pretty much every hospital in Southern California also, and a lot of other organizations that help our patients, whether it be directly with their kidney disease or indirectly helping them obtain food through food distribution centers, educating patients on how to apply, when to apply for disability benefits. What else? Educate patients that there's just not just one Medi-Cal program. There's several different Medi-Cal programs. And what I do is I try to screen everybody thoroughly and properly, asking all
Mm-hmm.
sorts of questions, whether about how much money they make, how much they have in assets, what their living situation is like.
Mm-hmm.
I ask, how are you? Can you walk okay? Do you need anything? Are you able to fill your prescriptions with no issues? Do you have any pending authorizations that are just taking too long? Because those I can usually take care over the phone.
Mm-hmm.
Um, are you getting any bills you're not supposed to be getting? Just yesterday, a lady of a patient of ours was complaining that she was receiving bills. She wasn't complaining about receiving bills. She wanted to pay them, but they were just too expensive.
Mm-hmm.
So what I did is I helped her obtain Medi-Cal benefits and took care of that. Now she has a zero balance with us, and it's has nothing to do but with writing off the amount. It's just it was properly processed with the new secondary that she has.
Mm-hmm.
So that's
Awesome.
yeah, that's my day. And besides that, before that, I worked at a couple of different homeless shelters in the LA area, where I
Mm-hmm.
learned about other resources that to this day are still helping me out whenever I see a patient that has this need, whether it be
Mm-hmm.
housing, financial aid, things like that. So
Yeah, you're a tremendous resource for people. And speaking of another tremendous resource, Cindy, we have a lot of patients reach out to you too. So what exactly, as an education nurse, how are you helping the patients?
Well, we certainly don't want this to be overwhelming. So, it's a step-by-step process.
Mm-hmm.
First, I really want to make sure that they have the education needed to make the right choice for their modality. So we talk about that. I think that's important that they're empowered with the education to make the right choice. And then the next step is to really, how are we going to pay for this? And, help them navigate that and really teach them and give them the tools of, how do I do this? How do I ask for this? Who do I talk to? You need to be the advocate. You need to activate your care. So it's just providing those tools to the patient.
Yep. Thank you. Thank you. Charmaine? Oh, I think you're muted a little bit, but
Yep.
would you like to
Yeah.
add?
Well, just, from a patient's perspective is I think it's really important to have that. Even though I've, transplanted like you, Kiku, over almost 20 years ago, but it's still, and information has come a long ways, since
Mm-hmm.
we transplanted, but there's still, we're talking to people, like my mentors, they still have, even though it's been explained to them and by certain people in the clinic or even, the doctors or whatnot, they still have questions about their insurance and their bills because it's so complicated. And
Mm-hmm.
so, yeah, I just try to explain based on my own personal knowledge, but then I also refer them, of course, to their social worker, to David, depending on where they're with,
okay.
things like that. So,
Thank you.
yeah, you're welcome.
We have a question, and I know we were going to do the Q&A at the end. I even told you guys that. But this one is really interesting. Mieko, I should get that right. She says, I do not work. I have been using my husband's insurance. Can I enroll in Medicare at 55 years old?
So yes, if you are entitled to it, for example, if your husband has worked at least the meets the minimum requirements for Medicare entitlement, and let's just say you've never worked your entire life or do not meet those minimum requirements, you can enroll into Medicare if you're diagnosed with a disability that impedes you from working for over a year. Having end-stage renal is one of those disabilities, so you can get Medicare based on your husband's work history,
Mm-hmm.
but only if you have that disability that impedes you from working for over a year. If not, you cannot. You'd have to purchase other type of coverage or continue under your group health plan through your husband's employer.
Okay. Thank you for that.
Mhm.
And perfect timing. Someone just asked me, what the heck is Medigap? That was from Daniel. He didn't say what the heck. He said, that was me. David explains Medicare Advantage pros and cons, but did not mention Medigap. Is it a better choice for a kidney patient?
In my opinion, yes, it is definitely the best choice for, and that's a fantastic question. I love that question because a lot of patients think, oh, Medicare Advantage, there's no additional monthly premium usually. There's this maximum out of pocket. But Medigap is a supplemental plan for the 20% coinsurance for Medicare. It's really important to know because it's usually the best option. Um, uh, as you know, Medicare finds you responsible for that 20% coinsurance for any type of treatment or care. Medigap policies, there's several. One specifically that I'll mention today is Plan G, as in George, and that plan will cover that 20%. It fills the gaps of services or the financial responsibility that Medicare doesn't cover. So basically that 20%. Plan G will cover that 20%, which means that if you continue paying that monthly premium for a Medigap policy, which can be unfortunately kind of pricey at times, you will be fully covered 100%. You will not be responsible for that 20% coinsurance. And basically what that means is that if you continue paying that monthly premium, your dialysis treatments would be zero. You pay absolutely nothing for dialysis treatments, except for the deductible that it doesn't cover. It's $203 at the beginning of the month. But again, that Medigap policy, incredibly important. And what's great about it is you stay on traditional Medicare. You're not locked into a health plan's medical providers. You can continue with that 97% of all Medicare contracted. With all medical providers that are contracted with Medicare. And again, that's 97% of all physicians and medical providers in the U.S. It's fantastic. And what's great about it is that because Medicare Advantage usually not always, usually continues to find you responsible for that 20% coinsurance for dialysis treatments. How do I put it? Medigap policies, again, how do I put it? I'm sorry, I got a little sidetracked. So what's important about Medigap policies, it not only will it continue to pay that 20% coinsurance for dialysis, but it will also cover Medicare Part B drugs. Medicare Part B drugs are medications that are not covered under Medicare Part D as in drugs. It's covered under Part B as a professional service. Services like infusion therapies, services like chemotherapy drugs that are not oral. Those usually are incredibly expensive. I'm sure Charmaine and you, Kiku, know how much it usually costs to continue on these immunosuppressant drugs. If you get a kidney transplant, then they're very, very expensive, and it's important to have that type of coverage. So if you are in a Medicare Advantage plan, it's very likely that you will continue paying that 20% for Part B drugs, whereas opposed to if you had a Medigap policy, you would be paying nothing for immunosuppressant drugs. And thus, I mentioned the premium without actually mentioning a price. So the price ranges anywhere between $130 all the way to $200, sometimes even more if you're under 65. So with Medigap policies, you can usually enroll at any time, but you have to go through underwriting, which means that they'll ask questions. Are you on dialysis? If you say yes, there's a possibility they're not going to want to sell you this Medigap policy because you might be an expensive patient. If you're a smoker, they might be able to sell it to you, but it's going to be more expensive. So it can get kind of pricey. But if
So
you
that's
get
the con here that you have right here. High monthly premium and no additional benefits.
Exactly. But if you enroll on the right time, like soon after or before you turn 65, then they will not ask you about your health, your previous health conditions. They will not ask you, are you on dialysis? The only thing that they're going to be allowed to ask you is, are you a smoker? And if you're not, through my research, there are some health plans where you will pay $130 for a month for this Medigap policy. And as long as you continue paying that, again, that 20% is going to be covered. Now that price for that Medigap policy will go up every couple of years, but it won't go up by much, $10, $20 or so. which is definitely manageable. At the end of the year, you would be paying anywhere between $1,500 to $2,000 a year for this Medigap policy, as opposed to Medicare Advantage plans, where they have a maximum out of pocket of an average of $6,700 a year. It's a big difference,
Yeah, that is a big
especially again,
difference.
if you're hoping your medical goal is a renal transplant. So
Yeah.
definitely something to consider.
Okay. Thank you for that. Perfect timing, Stephen. I have a question here. I am a senior recently diagnosed with end-stage renal disease, and at the same time, I've been called out of retirement by my company and offered the position of a lifetime. Ooh, that is a great gig. Director of Marketing for the US. We're an aerospace company, and while most of my work is virtual, I'll be required to travel globally from time to time and nationally several times a year. Must I turn this wonderful position down? Hmm. Cindy, would you like to take a stab at this? Let me stop sharing my screen here. That's a big question, Stephen. Oh, you're muted, Cindy. Okay.
Sorry. Offer the lifetime director of marketing for
Let
the
me
US.
see. Yeah.
So, with different options in dialysis, we do have peritoneal dialysis where you can travel with peritoneal dialysis.
That's
And
what I did.
yeah, and
But I did too.
you can camp, you can travel, you can still have a life. And depending on how long you're going and where you're going will determine, do you need to take your whole cycler, or do you need to do manual exchanges, or maybe you need to take both?
Mm-hmm.
And then with peritoneal dialysis, the actual center can ship the items to your location as well.
It's all about planning, right? It's just planning ahead.
Yeah.
Yeah. So
And I know, Charmaine, that you're going to say that too, that I can't decide if I want my glasses on or not, sorry. That I traveled all over. I went to Rome and to Tahiti for work, it's just like
Mhm.
you, Stephen. Um, so yeah, you just have to plan ahead and figure out how many exchanges you need per day, because I used to do it manually. I had a cycler at home. That wasn't my favorite thing to do, but PD was a great option for me because I was very active. And I think, Charmaine, you were on the same thought.
Mhm.
Yeah, I travel as well, and I mean I took full advantage of being. I mean I would just throw all that stuff in the car. I'd drive up north and to California and go to the Sequoias and camp and all kind of stuff. And it is a little scary at first because you don't want to run the risk of infection or peritonitis, of course, but
Right.
which is very easily treated. I just want to throw that out there.
Yeah.
And I just think that I had a client who was kind of very similar to this, just to put it out there, to just really plan like really far in advance, like start talking to your team, months in advance, because there may be something that, maybe they don't have a location. If it's overseas, there might not be a location for them to actually send it to, or a clinic. So that's just something that I learned not too long ago from one of my clients that,
Mm.
I think he was going to Holland or something like that, and they couldn't ship them directly there. So,
Mm.
and I could be getting the country wrong, but I'm just saying, like in general, like planning, and preparing
Hmm.
is just critical.
Yeah, I had my stuff delivered to a hotel in
Yeah.
Jamaica. So, there, as long as you are careful in doing your exchange, you're well versed in that. Stephen, I feel like you go get that job,
Yeah.
Yep.
Me
right?
Yep.
too.
There is
Do
no
it.
reason to stop your life because of this.
I
Absolutely.
say that
Yeah,
too.
Me
yeah.
too.
Wow, that's dope. Good for you,
Yeah.
Stephen.
Awesome. Congratulations.
Keep us updated,
Congratulations.
please.
Yeah,
Yeah.
keep us updated.
That'd be
Um,
awesome.
I'm not done with you, David. I've got, let me see. Will David review when the Medigap cannot ask me questions?
I, um, I think I understand the question. I mean, yeah, I review all our cases for every single one of our patients if needed. If they contact me, I'd be more than happy to review all their options. Again, I screen pretty thoroughly for all their options. I educate patients on their benefits, options, rights, responsibilities, most importantly, so that our patients can learn how to advocate for themselves whenever they need to. But I also help advocate those in need. So again, if you have questions about about which Medigap policy should I get, yeah, feel free to give me a ring and we'll talk about that. Yeah,
Do you want to put your info in the chat,
yeah, that's
David?
fine. I'll do that.
I have another question. Frank, I hope I'm saying Frank. Frank, on original Medicare, how does a patient find a good specialist? What is the process the patient goes through? And how does a primary care physician become informed of the patient's treatment once he is treated by a specialist? Cindy, that sounds like that's good for you.
Oh, golly, I can't even see that question, so I can go back
I
to
don't,
it.
I think I have to put my glasses on
Where is
again.
that? Okay. On original Medicare, how does a patient find a good
I
specialist?
think I read it right.
Yeah, so
Yeah.
typically the primary care physician will refer to a specialist, for example, nephrologist.
Mm-hmm.
And then I think what happens at that point is the administrative part of the office will go ahead and start processing the insurance, verify what's covered, if he's covered, if that specific nephrologist has room for adding additional patients. So it's a little bit of process in the beginning. And how does a primary care physician become informed of the patient's treatments? And then, to my knowledge, there is communication between the primary care physician and the nephrologist. And even when there is question whether or not that communication is transparent, my advice would be for that patient to be their own advocate and just confirming back to their primary care that they are seeing this particular nephrologist or specialist and moving forward in that care. I think it should be transparent. And I think sometimes it's really up to the patient to make sure that connection has been made.
Yep.
Right. Yeah.
So hopefully,
Be your own advocate.
yeah,
Right?
so hopefully that answers this to
I think
to
so.
Frank. Yeah.
Frank, let us know if that was cool. I
Uh,
have another question by Daniel. I have, we're going to get to your question, Daniel. We also have some other information I'm going to share on the screen while we discuss this. But first, what financial help is available, I'm going to share that so people can take a peek at that while we're talking. And David, you'll go over that shortly, right? Let's answer Daniel's question really quick because we're getting close to the time. Can I switch from one Medigap to another without having to do a medical questionnaire?
So that depends. It is definitely possible, depending on the situation. If, for example, you're just trying to switch from one Medigap policy to another because because the Medigap policy is no longer going to be available, the brand, or if it's Mutual of Omaha that's selling it to you, or you're paying a premium to HealthNet, or Anthem Blue Shield or Blue Shield or Anthem Blue Cross for that Medigap policy. Usually you have to go through the questionnaire, but many times there's special enrollment periods where it doesn't matter how old you are. And again, that's why it always depends on the situation. Doesn't matter how old you are, you can enroll onto a Medigap policy, and sometimes many times without having to answer that health questionnaire that you mentioned. So
He mentions he'd be moving to a different state.
so then yes, you know what? If you are moving to a different state and have a Medigap policy, that Medigap policy will still cover your services, that 20% coinsurance, out in a different state, as long as you are getting Medicare approved services. So
Okay. Thank you for
you,
answering
you
that.
don't you don't have to change your Medigap policy if you don't want to.
Cool. Okay, so David, you put together some wonderful information here. What financial help is available to folks? Let's talk about, the AKF is pretty amazing. Do you want to mention them real quick, David?
Sure. American Kidney Fund, it's a great organization. They offer several services. And if you qualify, there's a chance where you might qualify for their program. That, again, it's all information is available on the American Kidney Fund's website, but you might qualify for health insurance premium program, where if you're experiencing some kind of financial hardship and can't afford your insurance, say for example, your Medigap policy, or another example is if you initiate dialysis treatments with your employer group health plan, but then soon find yourself that you cannot work, you just can't for the moment, then there's a chance that you might be able to continue on the COBRA program. But everybody knows the COBRA program, which is a coverage that is offered once you leave an employer. It basically they'll say, hey, you can continue on your coverage, but we can no longer subsidize the premium. You have to pay 100% of it. There's a strong possibility that if you do decide to go that route and continue under the COBRA program, there's a chance that you might qualify for the American Kidney Fund's health insurance premium program to pay for your premium, or if not the full thing, partially. So that's one of the assistance, one of the help that you can get. For that, I do suggest contact your social worker at the dialysis clinic so that they can give you some additional information on that. The dialysis clinics, they have a fantastic team of insurance coordinators, social workers that basically do this exact same thing I do, and other things. Social workers are known for their emotional support and other things that they can do to help. But yeah, contact them. If you're having trouble with other things, medications are too expensive, there's the low-income subsidy program or extra help that's offered through Medicare, not necessarily through the American Kidney Fund, but offered through Medicare, where if you qualify, again, they might ask you for proof of income and stuff like that. Your medications can be dirt cheap, and you don't have to go through the gap phase of your prescription drug cost, which we didn't get into because it gets very complicated. They also call it the donut hole. But yeah, your medications can be
The donut hole?
Oh yeah, that's a horrible idea, but
Well, now
we'll
that's
talk about
crazy.
that some other day, I think.
Yeah, some other day. Well, we
Yeah.
have some other info here, kidney patient resources. And again, I'm going to post, most of this stuff is actually on remend.org, but I'm going to make sure we have everything. The National Kidney Foundation is kidney.org. Great information. Patient Advocate Foundation. Did you put these together or did I? I don't remember, David. But Partnership for Prescription Assistance, that must be you. I didn't know
Yeah.
about that one. Tell me about that.
So
Medicine assistance.
it's not just a partnership for prescription assistance, but there's several different organizations that help with the prescription cost if it's just too expensive,
Hmm.
if your insulin is just too much, and you know what, and if there is not assistance for that specific medication that you take that's so expensive, um, understand that there's other programs where they might be able to help out with some of the other medication that you're taking, and might be able to offset the cost for the expensive medication that you're taking. So this is just one of the organizations that offer assistance for paying for certain medications. Other assistance you can get are through your health plan sometimes. Other assistance, again, through the extra help or QMB, Qualified Medicare Beneficiaries Program, as they have Medicare has quite a few programs that might be able to help you out. There's copay cards, there's grants that you might qualify for. There's programs directly through the manufacturer of or the pharmacy company, pharmaceutical company, that might be able to offer you some assistance in order for you to be able to continue on that drug. So
Awesome.
yeah, that's just one of many that help out.
And I was reading the other day about, you and I briefly talked about it, David, but I didn't realize it was the American Association of Kidney Patients, their program called the Job Retention Program, which is kidneyworks.org.
Mhm.
Pretty interesting site. Maybe that's something Steven might want to check out. He was talking about his work, but
Yeah.
that's a great resource too. So we are coming to our 11 o'clock almost. So
Yeah.
really quick here, guys. I can't believe how quick the time flew by. What are some takeaways that you'd like to share with people. Like, what are you hoping people get out of our discussion today? Let's start with, let's get David a moment to gather his thoughts on that. Charmaine, what are you hoping people take away from today?
I hope that people take away the sense of empowerment for themselves. Like they really can become very active in their own care and be their own advocate, because I had to learn that the hard way. There weren't really a lot of resources available way back in the day. Kiko, it may have been the same for you, but take advantage of just the information that ReMend's providing, and any, like if you go through Balboa, like the resources that they have, and just really get educated about your own care.
Thank
Yeah.
you.
Yeah, you're welcome.
Great point. Really quick, someone just said, I heard you couldn't use a discount card with Medicare.
You know that's true in many cases, not always though. Some pharmaceutical companies also require you to have some other type of coverage, like commercial employer group health plan, in order to help out. So again, we've been talking about Medicare a lot, again, specifically because the annual election period is coming up, and there's a lot of patients who are going to be bombarded with mail with Medicare Advantage literature. They're going to be watching TV, and Joe Namath is going to be on TV saying that you should join a Medicare Advantage plans. I can guarantee you, I'm almost 100% positive that Joe Namath would not join a Medicare Advantage plan because a Medigap is a better option, unless he wants some basic dental and vision. But yeah, so that's why we were speaking. We're focusing on Medicare a lot because the annual election period is coming up, which starts October 15th and December 7th. But yeah, you're right. A lot of copay cards are only to be used if you have a commercial program or if you're uninsured. If you're uninsured, these copay cards sometimes do work, and a lot of pharmacies, I find, they will say, okay, you know what, let's just not bill your Medicare Part D prescription. Let's just bill you as a cash patient and see how much discount you'll get. So,
Thank you for answering
great
that.
question. Great question.
Cindy, how about you? What are you hoping people take away from today?
Hopefully this was just some really good information just to empower you with information relating to the financial responsibility of being a dialysis patient moving forward. So it's quite the journey, and there's just different chapters to it. And I always recommend that you keep a journal and start making your chapters. And this is one of the chapters, and just map it out, write it out step by step by step. So this part today was one of your chapters, and I think it's important to have that journal so you can refer back to it. And so it just doesn't feel all overwhelming, and take it from here to here. So
I love that. Thank you. Thank you.
Oh, that's nice.
That was awesome. David,
So hey,
parting thoughts.
just wanted to let everybody know that, again, you're not alone. There's a lot of help that's offered. Feel free to contact me if you have any questions. I'm not a broker, not a sales agent. Health plans are not going to pay me for helping you enroll onto a different health plan. Exactly. that just doesn't happen. I'm a patient advocate. This is my passion, and love helping patients. Love helping those that have medical needs, helping them reach their goals. And again, if there's a lot of resources, and if you need help finding resources, feel free to give me a call. I did put already my information on the chat, so feel free to contact me if you have any questions.
Yeah, guys, he's for real. He's the real deal, and that's, not always easy to find. So we're stoked to have all of you here today. I want to thank you all so much for your time. Very helpful information. Again, I feel the same. You're not alone. There's no reason you have to go through this all alone. You have a team of people that want to help you, and people like us at ReMend. You could visit us at remend.org. But I also want to show you. I'm going to share my screen here really quick. Our next event or broadcast will be the holiday stress in the kidney patient. Holidays are coming up, And this is just right before that's happening, October 28th. And we'll be featuring Dr. Alex Tebow. He's a licensed clinical psychologist with Sharp Healthcare. So we're going to talk about, what if you are diagnosed around this time of year, and then you've got the stress of the holidays coming, family coming to town. How do you deal with that? I think I was diagnosed around the same time too. So it's a pretty rough thing to go through, but we're here for you. So thank you so much for spending your time with us today. If you'd like to reach out, if you want to give us a call, 858-650-5001. Check us out at ReMend.org. We just recently updated our site. It's pretty cool looking, fresh and clean. We're also on Facebook. We're actually on Facebook Live right now. So you will be able to see this if you weren't able to catch the whole broadcast. It will be posted there and on ReMend.org. We also have an Instagram account. So thank you all for participating. And if I left out any questions, please reach out through ReMend.org. Have a lovely weekend.
Guys.